So let's talk about the workplace-based assessments. So lots of names from that. So the first one is, just to confuse you, CBD. So here is B for Bravo. So that's different from what we mentioned before, the CPD. So that's a case-based discussion. And from the name, it's a discussion. It's a discussion of a case. So, you saw someone, you discuss that with your senior and say, okay, we've had this discussion. This is my differential diagnosis for this case. This is how I'm going to manage it. And they ask you, okay, what are you going to do if this happens? What are you going to do this? So it's a bit of a discussion. It's ongoing between you and your senior. And this is how you get this assessed and signed off. Now, in sometimes you might see the word CAT or ACAT. So CAT in GP, you find that it's called Care Assessment Tool, which is the CAT, which is it's very similar to the CBD, but it's just in a different setting. So it's a primary care setting. The ACAT is for things in acute medicine or emergency medicine, which is a kind of a few CBDs together. So you get a few CBDs done together, and they call that ACAT. Now, the second one is KEX. And the way I remember it is also clinical evaluation exercise. Now, I always remember in my mind, exercise is almost like examination. So it reminds you of the OSCE. So if you're OSCE exam, you've got someone you're the patient, and someone watches you. This is exactly what it is, but it's in the actual workplace. So it's not an exam. You're seeing a real patient, but someone's watching you do that. And this is what we call the KEX or a mini KEX. Now, the other name for it, again, in GP land, we call it COT, which is Consultation Observation Tool, because they look at your consultation skill during that. So they look at how you're dealing with the patient, how you're consulting with the patient as well. Sometimes it have be a phone call, so it'd be like an audio call if it's a telephone, like a telephone consultation, but it's all the same thing. So the CBD is discussion, KEX is an examination or kind of examination or watching you do something, consultation with the patient. So the DOPS is the next one is a direct observation of procedural skills. So the other name for the DOPS is the KEPS, which is the one you use the GP. So that's basically watching you do a procedure. So something like a cannula, doing putting a chest drain in, any of that, that's called the DOPS. So again, someone watching you doing that. And then you've got something called MSF, or multi-source feedback. Now, the other name for it is 360. So it's like 360 degrees. So as if you're basically having you going through the whole 360, looking at you, how you are with everything. So they ask you questions about how you are clinically, how you are with your, interacting with other people. So it's no good of you saying, you might be the best doctor in the world, but actually no one likes to work with you. So that's the whole point of why this 360 is quite important as well. Now, foundation doctors might have it differently on their portfolio. It's called TAB, which is Team Assessment Behavior. So that's just another name. You find that on the Horus. It's all the same thing. So TAB or MSF 360. Next thing is patient's feedback. So that's not, you don't have to do that every year, but you need it for your revalidation every 5 years at least. But I think it's quite a nice thing to have as well. Having your patient's feedback, seeing how your patients think what they think about you. So you can send some feedback to the patients and then they respond to you again anonymously. That's part of your that goes in your portfolio as well. And then finally, your supervisor reports. So you've got ESR, which is the educational supervisor report, or CSR, which is your clinical supervisor report. So you might have either an education supervisor or clinical supervisor, or both, or might be the same person who is the education and clinical supervisor. So by the end of each placement, you need a report from them as well. So again, you send them this ticket and they fill it out for you, or they fill it out from their side, but it needs to be filled by them, not by you. Okay.